Hey everyone, it's Victor here, and I want to talk about my scar care routine. When I first came out of top surgery, I was thinking to myself like, oh, I have great skin, it's gonna heal up super nicely, I don't need to do anything. And so I was planning on just not doing any form of scar care. But as I started reading more, I started realizing, oh wait a minute, that could potentially be bad, and I could end up with much, much worse scars than if I actually did some form of scar care. Further compounding this, I read a lot of articles on basically surgical scarring in Asian patients, and that kind of freaked me out a little bit because I had always assumed that I had really great skin because my Asian parent has really great skin and like heals up from stuff really great, and I've always assumed that my skin was most similar to that parent, which, you know, for the most part it has been, until realizing that, you know, I have scars that have still not really gone away. And so that kind of got me thinking a little bit more, okay, maybe I should do some form of scar care. Around the 6-week mark, my incisions were definitely closed and therefore no longer incisions, but scars. And so at that point, I felt comfortable starting to do some form of scar care. I started scar care around the 7 or 8 week mark, just waiting for things to come in the mail. And so I've been now doing scar care continuously from whenever I started at like the 7 or 8 week mark until now, and I am a little bit over 3 months post-op now. Since I've been doing scar care, I think that it has helped a lot. Like I can tell that things are softening. I hope that the scars are lightening. They're definitely becoming a little bit softer where I've been massaging them, so I'm just gonna kind of walk through what that routine looks like for me and why I think it is good. With that, here's my routine. Alright, so I have this tape on, and that is called Sica Tape. I just got this online, and it is, I think, very, very good. It's flexible, it moves with me, it is not horribly expensive compared to, like, other things that I looked into. And it, in general, it covers, like, all of my scars, and I think it's been lightening them up and helping them get a little bit softer, I think. It's hard to know without, like, any kind of control where I, like, didn't treat part of the scar with the Sica Tape, but you know, it is what it is. I think it's helping, so I'm continuing to use it. First, I will peel away the Sica Tape on either side to reveal the scar underneath. And the Sica Tape is pretty sticky, and so it can be, it can stick to your fingers a lot. So I have like little patches that I put on my sides, where the drain holes are. And what I usually do for these little ones is I just use the previous week's Sica Tape, and I'll just cut it up into little bits, just the parts of the tape that are still good. Now that there is no tape on my chest anymore, I will use Lotion To Massage along the scars, and I usually use these two fingers. I used to only use this finger. I almost showed you, which I shouldn't do. I used to only use this finger, and then realized that my hand was getting really tired, and so I switched to 2 fingers, and that has been much better for continuing to maintain like a higher pressure without making my hand all tired. So this is the lotion that I have. I am not someone who normally uses lotion, and so this is just lotion I had on hand. I didn't go out and buy this. I don't know what I would buy if I were to go out and buy lotion, just because like I literally cannot tell you the last time I used lotion aside from doing the scar treatment stuff. So whether this is any good or not, I'm not sure. At the very least, it serves as like a lubricant as I'm going and massaging the scars, so that I'm not like, I don't know, having all that friction on my skin. So I usually get like a nice big glob of lotion like that, and then I like split it up, and this lotion rubs in pretty well, actually. It's like Burt's Bees brand, and I'm sure it was gifted to me sometime when I was like, I don't know, 11, or something like that. Alright, And then don't forget incision holes for drains. Drain holes, not incision holes. All right, and then I try and make sure I do not forget the nipples, because there are scars around the nipples too, and I try and at least massage those a little bit. I'm just going in a circle. And then you can go up and down like that. Sometimes I do that if I'm getting lazy, because the circle is a lot of effort. The first few weeks I was only using the Sica Tape and I wasn't doing this lotion massage. And I had noticed that especially the outsides of the scars, like this section and then also this section, were getting really, really hard. And so I decided to start this lotion massage thing because a lot of people say that massaging helps, and I actually can confirm, at least for me, the massaging has definitely helped. Where I can feel like this used to be like really, really hard, and now it's much, much softer. So I am trying to massage more rather than less, but I'm kind of lazy, so realistically I end up massaging like maybe 2 or 3 times a week. I should probably be trying to massage like twice a day, once a day at least. So that is an area of improvement for myself. I just find it difficult to do that when the, I don't know, you have to take the tape off and then you have to do the lotion thing, and I hate the feeling of lotion, and then you have to wait for the lotion to dry, and then you have to put the tape back on and make sure it's all positioned right, and then like, does that wear out the tape quicker? I don't know. Alright, so at this point, I have rubbed in most of the lotion where like it's now getting a little bit harder to do the massage. So I would normally either put on more lotion to keep massaging or call it a day and let the lotion all dry up and soak into my skin before putting on the Sica Tape. So for right now, I am just going to let the lotion soak in while I talk about the Sica Tape, because I feel like in a video about scar care, you need to talk about the scar care products. That seems to make sense, doesn't it? Alright, so like I mentioned at the beginning of the video, this is Sica Tape, and it comes in this roll of like beige colored stuff, and it is medical grade silicone, whatever that means. It comes in this nice thick strip, and it's perforated into like little sections. So like that's a section, that's a section, that's a section. So it's perforated, so you can just tear it. And what I do is, since it's so thick and my scars are not that thick, there's some reference, I will cut it in half down like that. So I will usually tear off 4 sections, because I know that that's how long my scars are, because I measured it when I first started doing this. So I'll tear off a section of 4 of the little blocky chunks, and then I'll snip it up the center, and then that gives me 2 thinner strips that I can then use along the incision lines. And so this is what that looks like. This one has been used for quite some time. This one's almost at 2 weeks, because I am, again, lazy at changing things like this. Although it still sticks, and it still, you can see the silicone still on it after 2 weeks of use. The box, the Sica Tape box, says that you can just rinse it with warm water and let it air dry, and then you can reuse them. And so that's what I've been doing. I've been trying to change them at about the 2 week mark. So every 2 weeks I will, I'll change them. So I counted the number of like box bits, like these guys. I counted the number of those in the roll, and there were 32 of them. And so since I use 4 blocks, because 4, and then I snip so that it gives me 2 of them that are 4 long. Since I use 4 blocks every 2 weeks, then that should give me 8 2-week periods, I think. So 16 weeks theoretically is what this should last me, which, you know, we're tracking so far. I've been pretty consistent with, you know, changing them out every 2 weeks. And this whole roll cost me, I think, like, it was somewhere between $12 and $18. I want to say it was no more than $20. And so I think that's a very reasonable price, especially compared to some other things out there, Mederma, Scaraway, Scarguard. So I've been very pleased with that. And it also, like, it moves with my body. Like, I'm a very active person. Like, with Sica Tape, I have gone swimming, I have played tennis, I have gone for runs, I have done, like, all of my workouts. I wear it in the shower. Like, it stays on very well. Around the 1 week mark, the little, like, edges will start to, like, come away a little bit and get less sticky. And then by the 2 week mark, they're definitely, like, getting much less sticky, but I've still never had a problem where they're, like, falling off in the shower or anything like that. So at least for me, the 2 week mark seems to be, like, you know, as long as I'm changing them every 2 weeks, they're sticking on there and not a problem. Since my incisions, especially this one, are curved a little bit, where, like, you have a little bit of a smiley face shape, it can be difficult because the strips are very straight, to figure out how best to curve it, without it getting all crinkly. But at this point, I have a method, and so it turns out okay, at least for this level of curvature in the scar. This side has never been a problem for me. And I'm gonna include this just in case anyone wants, like, a close-up of my incisions and scars. So this is the section that is, like, pretty, like, hard. And also, like, this section gets very dark purple, sometimes black if I haven't massaged it for a while. After a massage, it always seems to be a little bit better, and if I, like, run my finger down it, like, it turns lighter temporarily, kind of like capillary refill stuff. Yep, and then this center section is, like, really soft. Like, I can't, with my finger, I can't tell where the scar is if I wasn't looking at it. Same right here. And then this side is actually soft all the way. Actually, massaging may have been doing something, because this all used to be really hard, like this whole section here, and now there's a tiny spot there that's a little hard and a tiny spot there that's a little hard. And other than that, it's soft like the rest of it, so maybe there's hope that this side will become much softer. But yeah, that is a close-up of my chest. I think it looks pretty good. I'm very proud of it, and I've been really loving being able to see and touch and use it. Alright, back to Sica Tape. So today is actually my 2 weeks since I last changed it, so, but I'm feeling very lazy right now, and so I don't want to go cutting a new piece, so I'm just gonna put on the old piece, and let the new piece be a problem for future Victor. Alright. And then, like I said before, these little baby pieces, like when I retire these 2 strips, I will just snip off, like, little chunks of the best parts, and those will become my little baby pieces for the drain holes for the next week. And because obviously this is much longer than the little baby pieces, I can cut, like, multiple baby pieces from the big one, and so I really only have to reuse the baby pieces, like, once or twice, like, for 1 or 2 days before I can get a new one from the old strip. And so it works out quite well. I'm still a little bit lotiony, and so it's not quite sticking, but I think we'll be okay. And yes, that is covering the whole scar. I just try and check and make sure that it's covering everything it needs to cover, because again, since I'm lazy about this stuff, sometimes I go a day or 2 without checking on it, and it would be tragic to lose a day of it being on my body without actually doing anything, because it wasn't covering the part of the body that it needed to. Thank you all very much for watching. Please do consider liking and subscribing if you like my content. That would mean a lot to me. I hope you have a wonderful day, and until next time, I've got to put my shirt back on now. One sec. Good thing I didn't throw it too far away. I like this shirt a lot. Isn't that a great color? I like this color. It's not as good as royal blue, but still it is a blue, and it is a good color. I like blue. There we go.